You should always wear gloves in the lab to avoid transferring any fluids, and also if you touch another surface, you should change your gloves. And before you leave, you should remove your gloves and wash your hands. You should always be aware of sharp points on instruments, and when cutting with a sharp instrument, cut so that the sharp part of the instrument moves away from your fingers, hands, or body. You should never smoke, eat, or drink in the lab. You should never wear open-toed shoes in the lab. If you do, shoe covers are available. Also, never wear shorts in the lab. Your legs must be covered. Keep your hair tied back to avoid your hair getting into the cat fluids. There are goggles and face masks available if needed. There are also lab coats.
So the tools we use for dissection are our forceps, our probe, scalpel, and scissors, and our fingers as well. So for the forceps, these are really useful for helping grab tissue and also kind of helping pry away at connective tissue. The probe is good for also separating connective tissue from the muscle, as it's easy to insert into crevices of the muscle. The scalpel is helpful for exposing the muscle, but it's also kind of not always good to use because it does slice the muscle if you're not careful. Same with the scissors, they're good for cutting any skin or connective tissue that's in the way or removing fat, but it's also kind of difficult because you might also be cutting into the muscle. But our fingers are very helpful with just kind of prying away and making a good indentation so that it's easier to see the muscles with. The goal of dissections is to isolate the muscles and also to remove connective tissue joining muscles to each other so that they're easier to see and so that we may learn about the muscles. So after removing connective tissue, we're going to start with exposing the gastrocnemius. We have to use our forceps to separate the connective tissue that covered the muscle. So it's already kind of starting to expose itself. And it's under here. We can use the forceps to really start removing this tissue. And right here you can see the muscle after all this tissue is removed. So we use the forceps to separate from the soleus, which is right here. And be careful not to tear it. So here's the gastrocnemius. Right here. So here we have the soleus. It's pretty easy to find if you found the gastrocnemius. It's medial to it. And here's the gastrocnemius, here's the soleus right here. Okay.
Oh, we should show that between the two.
There we go. There it is.
Yeah.
And lateral to the soleus is the fibularis longus, which is this muscle here. So we just kind of keep separating the connective tissue from it to expose the muscle.
Oh, maybe I ran out of memory. Oh no, there's more.
And here it comes.
And then I'm gonna be like, now it's snack time. And then someone's gonna take it away.
And there's the fibularis longus. So this muscle here is the fibularis longus, as it's connected to the fibula, and it is also long. And then next to that is the extensor digitorum longus, which is easily seen after connective tissue is removed. And then next to that is the tibialis anterior, which is this muscle on top. So here's the tibialis anterior. So in summation, we have the gastrocnemius here, the soleus here, fibularis longus, extensor digitorum longus, and the tibialis anterior.